You are watching the Doctalk show.
Welcome back. We are discussing dental health, and in this particular show, we're going to discuss tooth decay or dental caries. What exactly is this common term that we hear about, tooth decay? They keep on telling us, do not eat sweets, it will cause tooth decay, but why is that so?
Now, before we move to tooth decay, first of all, what is tooth? A tooth. What are teeth anyway? So teeth are just part of the mouth. If you look at the mouth, we have the hard tissues and the soft tissues. Now, in the mouth, the teeth are part of the hard tissues. And the tooth is not just this white that you see. There is more to the tooth than just what appears in the mouth. We have the tooth itself. Then the tooth sits in what we call bone. And on the outside, you see the pink, or sometimes some people have dark, which is the gums. Now, the tooth, from what we see, will explain to you what you see as let's say, the layperson. The tooth is the hard tissue in the mouth that you can see. Yes, the one that is used for chewing, it's used for tearing, and you know we have different types of teeth. We have the incisors, which are the front teeth. We have the canines. These are the pointed teeth that are used to tear. They tear food. You find yourself pulling something from the side. Then we have premolars. Premolars are not so important, but they are there to fill the number of teeth. Then we have the part of also the most important, which are molars. Molars are the behind teeth that have grooves. So those are teeth. They are used for chewing, grinding, making sure the food breaks down into small particles for easy swallowing.
So, when we now mention the tooth decay.
Yes, now when we talk about tooth decay is disease of the tooth. Disease of the tooth is just not tooth decay. It comes with many factors that play together to form the decay. We look at the surface, which is the tooth. There has to be a tooth for you to get decay. There can't be decay without a tooth.
Okay, so decay in this sense, you mean in this outer part?
The outer,
the hard
tissue.
It can start to break down.
It can start to break down. It can start to get holes in them, but it just can't wake up. You just can't wake up one day and you have a hole. You get? It is a process.
It's a process.
Yes, and depends on basically 4 factors. There is the food that you eat, and this food mostly has to be comprised of sugars.
Mainly sugary foods.
Mostly sugary foods, yes. Sweets, the syrups, sugars basically. Then there has to be time duration for that food to linger around the tooth. There has to be time. That's when you brush after eating, you don't give the food time to stay around the tooth.
Which is a good thing.
Which is a good thing. Yes, which is a good thing. Then we have the bacteria in the mouth. Now the mouth has good bacteria and bad bacteria. When you eat food, which is sugar, the bacteria feeds on that food and it breaks it down. It produces acids as part of the products of feeding. Just like any human being you eat, there is byproducts that pass out. Now this bacteria also feeds on those sugars. Now it is those acids that will penetrate the hard surface of the tooth, which is the enamel. I think many of us know enamel is like the outer layer of the tooth.
Well, they may not really know. Maybe Dr. Kalisa can tell us more about the tooth itself. Is it like one piece of bone? Some people say it's the bone. Is that true?
I would say it's one piece of bone in a layman language, but then it has other subunits. So the enamel is the outermost coating, the strongest part of the tooth. Yeah, exactly. The white or the creamy or the gray surface we see. Then just beneath the enamel, we have the dentine. It's the second layer. It's usually more creamy and it's a living layer of the tooth. It has living cells, it has nerve endings that run off from the pulp. Then beneath the dentine, we go to the pulp, or the pulp cavity. That's the part of the tooth that harbors the nerve endings and the blood supply to the tooth. So
like
basically there are three layers of the tooth.
teeth.
Yeah. Every individual is susceptible to caries, but the highest susceptibility we usually encounter on the clinical basis are usually the children and the elderly.
Okay.
There's a statistic that shows that 85% of individuals before 18 years, they've suffered caries in one way or the other. So the reasons why our children and the elderly are susceptible to caries is because they are usually, there's a tendency of oral hygiene neglect in the children and the very elderly. They can't really clean the surfaces off well. Then in children, these days children are exposed to syrups, and most of those syrups have the sucrose.
Like the medicine,
Exactly.
the medicine syrups.
The medicine syrups.
And it has sucrose.
It has sucrose. So the more they're exposed to that, that means that the bacteria are rejoicing. They are having what to really feed on,
Really? So
metabolize, and then
so
end up
we
with
shouldn't
caries.
give syrups to children?
You should give syrups to children, but then it's advisable that after you've given the syrup, immediately give the kid some water to rinse off the sugar. In other words, you're getting rid of the time. Exactly. You're cleaning off the sucrose, so there's minimal contact of the sugar.
Maybe to add on, sometimes it also comes down to the parents. The parents are ignorant when to start brushing the children's teeth.
Yeah.
Well, that's a good question.
Yes.
When should children start brushing teeth?
The child's teeth should be cleaned as soon as you see the first tooth.
The very first
The very first tooth. So that is at around 6 months. As soon as you see the first teeth, just know that now the routine of cleaning should start. For babies,
and how should they clean it?
yes, for babies, obviously there are few teeth. Then, of course, the opening habit is not good. So most times we advise mothers to get either a cotton swab or
Piece of gauze, wrap it
gauze,
around the finger.
wrap it around the index finger, and just clean over the few teeth and the tongue of the baby.
Do you use toothpaste for babies?
No.
What do you
No.
use?
For babies, just use water, and it can be with a little salty water, just in case of lesions. Some babies have sores that you can't know. So once in a while, you can just use a little warm water, dip in the gauze, clean, and that is it. As the kid grows, less than 3 years, you can get for them very soft brushes, but you have to guide the baby to brush. The mother has to guide the baby, and up to 7 years. As the child is growing, before 3 years, you can just smear the brush with a paste. Just smear it. You don't need to put a piece. Just smear and guide the baby to brush, because then they end up swallowing. They like anything sweet, and you notice these toothpastes have sugars. So you just swab a little on the brush and you guide the baby to brush. As they grow older, like 7 years, you give a peanut pea size of toothpaste, very little, because you're just decreasing the chances of the baby swallowing, of the child swallowing the paste. So as they become more independent and know that they're supposed to spit what they are brushing, then you increase the quantity.
Yeah,
Okay.
it is, just to add to that, it's equally important. Most patients always ask, but doctor, should I give this kid a toothbrush? It's okay, it's fine. You give it to them cautiously so they shouldn't injure themselves. And then the other very important thing is that it makes them get used to the brushing habits.
Get used to the routine.
So the earlier the kid is introduced to the early brushing, the better.
And you should brush how many times?
They can do it twice daily, like an adult, in the morning and evening before they get to bed.
And you can make it a routine, like make it fun. When you're brushing, he's also there, and you're making it feel like it's a good activity, yes. They will also enjoy, they'll see you go to the sink and rinse, and they also want to do something. Just know they copy, children copy. So the earlier they copy,
So they
the
must
better.
copy from adults.
Yes,
Yeah.
and it's good
so-
to copy the good, not the
Copy
bad.
the good, exactly. So
Yeah.
remember, you're watching the Doctalk show. We're discussing a very interesting topic, dental hygiene and how to prevent dental caries without dentists in studio. Send in your questions and comments on the social media at Facebook, Twitter. You can also log on to the YouTube page, subscribe and like the videos and share with your friends. So after the break, we shall come back more to learn what could go wrong if people don't take care of their teeth. Can these dental caries cause problems? And if there's a way we can prevent ourselves from getting dental caries. So after the break, we shall discuss this. Don't go away.
You are watching the Doctalk Show.